Hello guys, it's your girl Nash. Kung napapansin nyo, ang tagal ko na pong hindi nakapag-vlog, it is because naging busy po ako sa pag-aaral ko, and also I'm taking good care of my two sons. At sad to say na hindi din po kinakaya ng phone ko yung pagva-vlogging kasi nga po it takes a lot of things to do. So like for example is magvi-video tayo ng for how many minutes and then mag-edit tayo. So since mababa yung internal memory ng phone ko is hindi po niya kinakaya yung vlogging, no? So what I am going to say to you today is that I just want to say sorry guys for being inactive for this past few months talaga, because I don't remember the last month or kung ano talaga yung exact month na nag-vlog ako. So ang i-discuss ko or ang sasabihin ko ngayon dito sa vlog na ito is all about reacting a video, or hindi naman siya totally react. Magbibigay lang ako ng some learnings. Ewan ko lang kung makakapagbigay ba ako doon sa video ni Rana Harake talking about yung speech delay. No, so nabanggit niya doon sa video niya na yung anak niya, si Nisha or si Ranisha, is papunta na sa autism. And kapag hindi siya talaga naagapan yung speech delay na yun is mapupunta siya into autism. So ano nga ba yung autism? By the way guys, I am using these books, Child and Adolescent Development. So I got it when I was in first year college, and pinabookbind ko siya kasi nga bilang education student I need to learn or study the behaviors of students or the behaviors of kids so that maintindihan natin kung ano ba yung inuugali ng mga childrens, and kung paano natin malalaman kung paano natin sila i-handle in the future. So, I have here autistic disorder. No, so bilang nabanggit nga po ni Rana Harake yung autism, let's try to discuss it, pero hindi pa po ako expert na magdi-discuss, but I will try my best. So we have here autistic disorder. So what is autistic disorder? It is a pervasive developmental disorder, otherwise known as early infantile autism or childhood autism. So autistic disorder is characterized by the inability of the children to communicate and interact socially. So meaning, dito sa autism, ang sinasabi nila is yung mga bata dito is parang nahihirapan silang makipag-communicate. Doon nga sasabi ni Rana Harake, yung anak niya, kapag tinatawag niya ng pangalan, hindi siya sumasagot, right? Or hindi siya nakikipag eye-to-eye contact. And parang ayaw niya din makipag-interact socially. So, it is one sign of autism. Actually, pangalawang sign na yung sa kanya kasi ayaw niya makipag-interact socially, and also ayaw niya ding makipag-communicate before, diba? Sabi niya before. So now, mabuti naman at may therapy. So these autistic children have specific language deficiencies, demonstrate a need for sameness in their environment, and engage in repetitive behaviors. Okay, so these features includes letter A, extreme autistic aloneness. So what do you mean by extreme autistic aloneness? So it means an autistic is a loner. He or she expresses lack of interest in other people. So meaning, ang mga tao daw na merong autism is loner. ayaw nila ng, hindi sila nagpapakita, or maybe, parang wala siyang interest, ganun. Parang wala siyang interest sa ibang tao, or sa school nga, 'di ba? May mga taong may sariling mundo, or let's say loner, walang kasama, ganun. So letter B is language abnormalities. Rather than engage in conversation, the autistic tends to repeat the words rather than reply, answer, or engage in conversation. So, sabi dito sa language abnormalities, mas gusto daw ng mga may mga autism or autistic na ulitin yung mga sinasabi nila kaysa mag-reply. Kasi nga, parang sabi nga ni Rana Harake, yung capability ng anak niya is for 6 months. So, since ang anak niya is already 2 years old, I watched in her video, parang hindi siya, hindi siya talaga pwede na hindi siya aanuhan ng therapist, kasi hindi siya talaga makakapagsalita. We parents, we doesn't even know kung ano yung gagawin sa mga babies natin, so we need an advice from a doctor na alam natin ang kakayahan, or alam natin kung saan siya expert. So, letter C here is repetitive behaviors. So, an autistic extends concentration on something and preserves the sameness of the environment. So, yung mga autistic daw, nagko-concentrate lang sila sa iisang bagay. Like for example, if naglalaro, so kung gusto nilang maglalaro at maglalaro lang sila. Hindi sila parang yun lang yung nila, center of attraction, like that. So public awareness about autism has improved. There are more films and books about autism, aside from the introduction of the use of broader diagnostic criteria, thus increasing the number of children being labeled autistic. Usually, autism commonly appears in boys than in girls. So the ratio is 3 to 5 boys to 1 girl. Okay? So, sana guys, medyo naintindihan natin kung ano yung ibig sabihin ng autism. Well, meron lang din akong reaction doon sa sinabi niya na yung napakasakit sa ating parents na ipagkumpara sa ibang tao yung anak natin. So, bilang siguro, masasabi ko lang is, super sakit talaga guys, kasi alam nyo ba, I have 2 sons. Yung isa, super tigas ng ulo, and the other one is, parang hindi siya nataba. So, yung firstborn ko, pinaghihinalaan ko meron siyang ADHD talaga. So, ano ba ang ibig sabihin ng ADHD? ADHD meaning Attention Deficit Hyperactivity Disorder. So, ano nga ba yun? Attention Deficit Hyperactivity Disorder interferes with an individual's activity to focus or in attention, regulate activity level or hyperactivity, and inhibit behavior or impulsivity. So among children and adolescents, it is one of the most common learning disorders. The young from ages 9 to 17 are affected for at least 6 months and are more common in boys than girls. This syndrome is manifested early in the preschool or early elementary years, but can persist into adolescence and occasionally into adulthood. So, paano ko nga ba nasabi na merong ADHD or merong symptoms ng ADHD yung panganay ko? Hindi po siya mapakali sa inuupuan niya. Like for example, kung manonood siya ng video ng sandali, like 4 or 5 minutes. And after that, malilibot niya na itong buong kwarto na to, And then, bigla siya magsasalita, sisigaw, tatakbo kung ganito, ganyan. So, and then, it's not normal, I guess, um, uh, para sa mga batang bigla-bigla na lang sumisigaw. By the way, my son just turned 3. So, feeling ko, let's see kung ano talaga siya ng ADHD. Kasi nga, eto nga, meron siyang nakalagay dito na all about ADHD, no? So, children with ADHD need assessment from healthcare professionals with the help of parents and teachers. There is no specific test for ADHD, but it can be diagnosed through a series of psychological tests, physical examination, and observing child's behavior in day-to-day setting. So, what causes ADHD? ADHD is a neurologically based medical problem caused by a number of factors. The exact causes are, however, unknown. According to some research studies, the disorder results from an imbalance in certain neurotransmitters, most likely dopamine and serotonin. These substances help the brain to achieve focus and regulate behavior. Certainly, parents and teachers do not cause this disorder, but may lessen or worsen the effects of the disorder. So, ADHD is associated with the symptoms in children like difficult pregnancies and problem deliveries. The risk is compounded by maternal smoking and exposure as well to environmental toxins. Other studies indicate that the ADHD brain consumes less glucose, its main fuel source, especially in the frontal lobe regions. So, ang reactions ko lang, or ang masasabi ko lang dito, is nung pinagbubuntis ko yung baby ko, never naman ata akong tawag dito never akong nagsigarilyo, never akong uminom, or whatsoever. Hindi naman siguro din ako na exposed sa environments, kasi nga ang ginagawa ko lang is school, bahay, like that. And hindi po ako ganun naglalakad kasi nga po natatakot ako. Pero siguro etong stage ng baby ko is like makokontrol natin siya. So let's see. And hindi ko siya alam kasi hindi ko pa siya napa-check up. Hindi ko siya napa-check sa doctor kasi nga wala pa po kaming budget kasi nga po estudyante pa lang po ako and also my mister. By the way, I am a third year college student with a course of Bachelor of Elementary Education here in Cotabato City. So, yung second baby ko naman, hindi siya talaga nataba. Kahit anong gusto kong pakain sa kanya, hindi talaga siya nataba. So, what would I do with that, right? Siguro, God knows how much I want them to be healthy and all. Pero since wala nga po akong magawa, idadaan po natin lahat sa prayers. And to Rana Harake, no worries girl, pareho tayo. And doon sa sinabi mo na pinagko-compare, actually, itong second baby ko is napagko-compare siya sa ibang bata kasi yung mga kaedaran niyang bata talaga is sobrang like mataba talaga or health, ewan ko. Itong baby ko naman palakain din naman siya, but hindi lang talaga siya nataba. So, ayun. Sa mga parents na may mga ganitong sakit ang anak, huwag po tayong mag-worry. Kasi po, nandyan po si God para po tulungan tayo. And also, doon sa mga parents din na pinagko-compare yung babies, wag po tayo mag-alala dahil hindi po mahalaga yung opinion ng ibang tao. So, that's all and thank you.